local station.
Coming up on 7:43 now, in our Better Bodies report today, chronic pain, especially back pain, is a largely misunderstood and undertreated condition that affects millions of Americans. Now, though, one local neurosurgeon is treating some people with back and limb pain with a procedure called spinal stimulation, one they test drive, so to speak, before committing to surgery.
There are 2 shirts. Where's the third one? Where did you put it?
Whether she's getting her girls ready for chorus or karate, Pam Zimmer is always on the go. But for years, chronic back pain derailed her life.
It takes a toll on your emotions to always be in pain. You can't get down and play with them. You can't go to the park. You can't take them for walks.
After years of trying different treatments and a scary amount of prescription painkillers, Pam went to St. Vincent's Spine and Brain Institute, where Dr. Eric Gabriel performed a procedure called spinal cord stimulation.
Perhaps they've had surgical intervention in the past, but they failed all forms of treatment that are typically used to treat pain nowadays. And this is another option for them to help them with the chronic pain.
Pam's pain management doctor did a temporary procedure first, so Pam could find out what kind of pain relief she might get with the permanent implant. Encouraged by the trial results, she decided to have the surgery.
In my personal experience, many patients have really been able to change the whole quality of life. They've been able to get off medications or at least wean down their medications.
Dr. Gabriel places a special array of electrodes over the area of the spinal cord where the pain signals come from. The electrodes are connected to a thin wire placed under the skin that runs to a small pulse generator implanted in the buttocks. When turned on and programmed, the device short-circuits pain signals and replaces them with a tingling or massaging sensation.
It's like a lazy boy.
Pam's far from lazy now. She's studying to be a nurse and enjoys an active life again.
I can take my kids trick-or-treating. I took them to Disney. I haven't taken my kids to Disney and not rented a wheelchair, ever. I'm in school. I got accepted into the nursing program. I passed the physical. It's, you know, I can do things I want to do again.
Pretty incredible. Pam says spinal cord stimulation relieved about 80 to 85% of her pain. She takes an over-the-counter drug when she needs to. It's a far cry from what she used to take. And as you heard Dr. Gabriel say, the goal is to reduce or even eliminate the need for any pain medication. So we've got a local doctor in to discuss spinal stimulation, find out if it's right for you. We'll talk to him right after the break. And later at 8, tickets to a unique holiday event. Stay tuned for your cue to win passes to First Coast Winter Lights. And Richard's back with a look at your soggy forecast for the... Ashley, let's go into the spinal stimulation procedure we were talking about out of St. Vincent's. Dr. Scott Kramerick is a pain management specialist who performs the trial procedure, because this is a 2-part procedure. Good morning to you, and thanks for joining us.
Sure.
First of all, let's talk about the intense pain some of your patients feel in back pain.
Right.
You go through the host of regular procedures, medicine, physical therapy, other things. When that doesn't work, people really need a solution.
That's right. This isn't the first thing that we reach for, because it's a technology big gun. But after we've done what we can do with adjusting the medications, prescribing physical therapy, doing all the right x-rays and special diagnostic tests, this might be something we can consider. When we see patients in the office, we do a complete physical exam and we look for things that might be correctable by surgery as well. But if they still have back pain and leg pain, then a spinal cord stimulator is something we can think about.
All right, so you do the initial procedure. What does that involve?
Well, it's a trial procedure. It's done usually in about 30 minutes with local anesthesia and a single needle stick, so it can really be done in any surgical sterile setting. We do ours in the office. We send patients home for a few days so that they can experience the effects of stimulation in their usual setting with their usual daily activities. And so we'll have a pretty good idea at the end of 3 days whether the trial is going to be helpful for them.
So in 3 days they can find out whether they should do the complete procedure. Is this something that they will have to have for the rest of their lives? And can they control the output of sensory information that goes to that nerve?
Yeah, the stimulator system itself is highly adjustable. We can program it within certain limits, and then patients can adjust it with a little remote control. So they can turn the stimulator up and down, on and off. They can choose different areas of their body that are having pain and target those areas. Patients usually have it higher during the day when they have activities and lower at night while they're sleeping.
And they can have it implanted in their body forever?
They can have it implanted forever, yeah.
What side effects are caused by this?
There really aren't any long-term side effects from electrical stimulation. I mean, we're using electricity, not drugs, and the effect of stimulation is really like flipping a switch. And so it's interrupting the nerve pathways, the conduction signals that go up to the brain. So it replaces what we would normally perceive as a painful stimulation with something that's like a massaging sensation. So it's nice.
That's incredible.
Yeah.
If you want to find out whether you are a candidate for this spinal stimulation, we've got the phone number for St. Vincent's Health Link. It's 308-LINK. Dr. Scott Kromeric, thanks so much for being with us this morning.
Thank you very much.
Giving relief to a lot of people who need it. All right, 7:52 now. He is responsible for cooking